Alright, so I'm getting ready to make my synovial joint, and I've chosen the elbow. So this is what I have so far. I'm thinking that this is going to be the humerus, and then these two are going to be the radius and the ulna. I'm thinking that I'm going to show the muscles using these pipe cleaners. I might use these for the end of the bones, just to show the landmarks better. Rubber bands. Oh, and the clay. I'm thinking I'm going to use different colors of clay to show the different cartilage, ligaments, and tendons. And maybe some even landmarks. Some labels so that I can label everything. And then I drew some diagrams today so that it'll make building this a little bit easier, hopefully. So we'll see. Alright, so this is my second clip now that I have some clay on the bones just to make them, or on the wood I guess, to make it look more accurate in size and shape. So this is what I have, and I've been trying to base it off of this picture here, looking at the medial side, and so I'm thinking that this is going to connect here like this, and then my radius will connect under that, like around there, so that when I look at it from the side it looks like the picture. I just have to figure out how it's all going to stay together, and then I have to add all the muscles and the tendons and the cartilage and all that too. Alright, so I'm almost done. I just have to add on the labels with all the names of the bones and the landmarks and the tendons and all that. But yeah, I've added the muscles and the tendons, all the ligaments, and I figured out how to make this move more efficiently, because before the clay would have so much friction that it wouldn't move very well. So I just added a little bit of tape to the bottom of that, and I figured out that that's what articulating cartilage also does. So yeah, now it moves better, and it moves in all the planes that it has to, and yeah, so I just have to add on those few things, and then I'll be ready to say my final presentation on this. Alright, so here's my elbow in its complete state, and I have my labels all on it. And yeah, so here's my elbow, and an elbow is an example of a hinge joint, which just means that there's a convex surface that fits into a concave surface. The motion is limited to flexion and extension in a single plane, which I will show you at the end, just so that these label stickers don't fall off until then, but I will show you. Alright, so starting with the bones, we have the humerus, the radius, and the ulna. Some of the landmarks on the humerus include the head, the shaft, the deltoid tuberosity, the olecranon fossa, the lateral epicondyle on the lateral side, and the medial epicondyle on the medial side, along with the trochlea, and I will zoom in on that part later. Just with the radius, here's the radius, this bone right here. It also has a head up here, hidden. The radial tuberosity and the styloid process of the radius. Then we have the ulna here, this bone here. It has an olecranon, the olecranon process, the trochlear notch, the coronoid process, and the radial notch of the ulna, ulna tuberosity, and the styloid process of the ulna. A bunch of those I just said are hidden under here, which is why I went a little fast. But just showing this part here. Okay, so I just took off one of those ligaments. Alright, so here we have Right here is the coronoid process. This whole part here is the trochlear notch. And here the purple will be the olecranon. We also have an elbow bursa back here, which I'll talk about later, but just as I'm in this view. All right, I'll put this ligament back there. Okay. All right, so now we can go into muscles. The point or the purpose and function of muscles are to provide movement. It's the only tissue in the body that has ability to contract and move other parts of the body. All right. So some of the muscles. There's a long list of muscles. This one here is a bicep, which I will go into a little bit more depth after. Okay, so a brachioradius. We have an extensor carpi radius longus, an extensor carpi radialis brevis, an extensor digitorum, an extensor carpi ulnaris, an ancinus, and triceps brachii as well. And the triceps is here with my orange pipe cleaner at the back, or the posterior. All right, so I'm just going to go into a little bit more depth on the biceps and the triceps. And the other muscles I mentioned are here, represented by these pipe cleaners. All right, so my bicep. Let's start with the bicep. The bicep, the origin for the long head is the supraglenoid tubercle of the scapula, and the short head origin is the coracoid process of scapula. The insertion is the radial tuberosity of the radius, and the action is that it flexes the forearm at the elbow and supinates the forearm. All right, back to my tricep. So the tricep origin, the long head origin is the infraglenoid tubercle of scapula. The lateral and medial head have an origin of the posterior humerus. The insertion is the olecranon process of ulna, and the action is that it extends from the forearm. It extends the forearm at the elbow. All right, now we're at the tendons, and the tendons function is just to attach muscle to bone. It's known as the dynamic joint stabilizers. Too much strain on these can result in a tear, and it's just a large bundle of white fibrous protein called collagen. An example I have are extensor tendons, which I have here just as the clay. It's just connecting the muscle to the bone here. Next is the cartilage, and cartilage just protects the ends of the bone and allows for smooth contact as the muscles move. So for mine, I use tape, if I can find it. There's tape in here. There, you can kind of see the tape. I showed it in one of my clips of me building this. I just use tape as articulating cartilage or hyaline cartilage, and it just makes my joint move more efficiently, makes it more smooth contact. And then we have the bursa, which is just a small flattened fluid sac found at friction points between tendons, ligaments, and bones. And the example I had was the elbow bursa, which I showed before, which is where your elbow would be. All right, so now I'm going to talk about tennis elbow. Tennis elbow is a common injury that causes pain on the outside of your elbow. It's not only seen in tennis players, it's also seen in other sports that involve repetitive stress on muscles around the elbow, such as weightlifting. The symptoms are there's pain about 1 to 2 centimeters down from the bony part of the outside of the elbow, known as the lateral epicondyle. Yeah, right there. Also, you have weakness in your muscle around the forearm and wrist. A doctor or professional therapist can perform a number of assessments to test for this diagnosis. Causes is just overuse. It occurs at the junction where the tendon of the extensor carpi radialis brevis muscle, which is one of these ones, inserts into the lateral epicondyle of the humerus, which I showed over there. And this can either be acute or chronic. If it's acute, it just means that the injuries occur immediately, like if you hit a backhand shot in tennis poorly and it causes a micro tear in the tendon. Or it could be chronic, which just means it occurs over like a couple days or even weeks following intense exercise. Treatment for that is just rest, ice, gradually increasing the load on the elbow, and a tennis elbow brace if needed. And yeah. Oh, and I gotta show that it moves. Okay. So hopefully all my labels don't fall off. But as you can see, it moves in the plane that it has to, which is again just flexion and extension. Like that. And yeah, that's it.